Cardiovascular disease, commonly known as heart disease, is one of the leading causes of death worldwide. It includes various conditions that affect the heart and the blood vessels, such as heart attacks, strokes, and high blood pressure. Heart disease can affect anyone. However, research has shown that younger women, typically those under 50, have some natural protection and are less likely to develop cardiovascular disease compared to men of the same age. This natural protection in younger women is mainly due to some hormonal effects, health behaviors, and differences in body fat distributions. In this video, I will be explaining why younger women are protected from heart disease and why it is still important for them to take care of their hearts. Before diving into the reasons for this protection, it is important to understand what cardiovascular disease is. Now, the heart pumps blood throughout the body, and the blood vessels carry oxygen and nutrients to keep our organs functioning properly. Cardiovascular disease occurs when these blood vessels become damaged or blocked, often due to fat buildup, high blood pressure, or inflammation. This can lead to serious problems like heart attacks or strokes. Cardiovascular disease can be caused by factors such as smoking, unhealthy eating, lack of exercise, and family history. One of the main reasons why younger women are protected from cardiovascular disease is a hormone called estrogen. Estrogen is a female sex hormone that is most active during a woman's reproductive years. The results of years of research into female sex hormones indicate that estrogen has many positive effects on the heart and blood vessels. First of all, it helps keep arteries flexible and smooth, making it easier for blood to flow through them. Now, this reduces the risk of blood clots and high blood pressure. Secondly, estrogen helps control cholesterol levels. It increases the high-density lipoproteins known as good cholesterol and lowers the low-density lipoprotein known as bad cholesterol. By keeping the cholesterol balance healthy, estrogen helps prevent blockages in the arteries. Lastly, estrogen reduces inflammation, which is another factor that can damage the blood vessels over time. In these ways, estrogen acts like a natural shield against heart disease in younger women. Before menopause, women tend to carry more body fat around their hips and thighs, while men and older women often carry fat around their belly. Belly fat is also known as visceral fat. It is more dangerous because it can release harmful chemicals into the body that increase the risk of heart disease. Since younger women usually have less visceral fat, their risk of heart-related problems is much lower. This changes after menopause when fat distribution may shift, and that increases their risk. During menopause, estrogen levels drop significantly. As a result, the heart protective effect of estrogen begin to disappear. Arteries may become stiffer, cholesterol levels can worsen, and blood pressure may rise. This is why the risk of cardiovascular disease increases sharply for women after menopause, eventually becoming equal to or even higher than that of men. This shows that while women may have an early advantage, they must still be cautious as they age. Even though younger women are less likely to develop cardiovascular disease, it does not mean that they are completely safe. There are still risks, especially if someone has unhealthy habits. Smoking, poor diet, lack of physical activity, stress, and not having enough sleep can all increase the chances of developing heart problems, regardless of the age. Stay safe, and thanks for watching.